Hi, my name is Dr. Anna Saylor with Van Every Family Chiropractic Center, located in Royal Oak, Michigan. And we are going to adjust Melissa. So
Hi, I'm Melissa and I'm 7.5 months pregnant.
Yay! Yay. Melissa's been having a little sciatic issue with the pregnancy. And she's having a girl, another girl.
And I need a name.
I gave you one.
I need that book first.
Oh, yeah. Melissa's not sleeping very well between having a toddler and being pregnant, so. And the reason why we knew that is we just adjusted her sphenoids, which is the bone that's right behind the eye. And when it's out on both sides, it tells me the patient's not sleeping very well, so. We know that. And being a mom, we know that too, so.
Sleep?
Sleep, what's
What's
that?
that? I know what she likes to do out of the big bed. Yeah, funny. Yeah, that's funny.
Tell me.
Yay! I kind of want to lower pains.
Lower.
Did you have that too, like real low, besides the sciatic?
Yeah.
And sinuses. Stuffy. That's normal though, right?
No, we'll adjust you for it.
Oh yeah.
Okay, so because you're pregnant, and because she's pregnant, she can't really take a lot of different things. So we can do a lot of sinus work to drain everything, get everything to open up. So we'll just adjust along the face. Is that okay?
Mm-hmm. Feels great.
Awesome.
There you go.
What we're going to do is turn to the baby and what the baby needs. A lot of times babies in utero can actually tell us where the mom needs to be adjusted, so we can increase circulation. We can help if there's an area of the mom that's is tighter that we can actually adjust, and it'll help the baby move better. A lot of times we'll see like the middle of the back, which is the circulation to the uterus, to the placenta, actually increase the energy flow to the baby. So we see a lot of different things. So what we do is clear the mom first, and then now focus on that baby. So this is for the baby. So we actually have to adjust first for an emotion.
Koala. That's a koala bear, right? Oh. Open it up.
I know, exactly.
Down here.
And just kind of go all the way up. That feel okay? She's like, what are you doing?
Yeah.
Did you eat something recently kind of funny?
Me?
Yeah, kind of.
Last night.
Baby didn't like that.
No?
No.
What did I eat? A banana split? Chicken.
There you go.